You went to bed last night feeling fine. Maybe a little tired, maybe a little stiff in the neck, but fine. You woke up this morning and your arm was numb. Not just the pins and needles tingle you get when you sleep on it wrong. Something deeper, heavier, and it took a few minutes to shake off. You probably wrote it off, rolled your shoulder, made your coffee, moved on. Pause. But here's what I need you to understand. In those hours you were asleep, something was happening inside the blood vessels of your neck and the arteries feeding your brain that you had absolutely no idea about. My name is Dr. Alex Carter. I'm a board-certified cardiologist and vascular health researcher with over 22 years of clinical practice. I've worked with stroke prevention teams at major medical centers, and I've sat across from hundreds of patients, intelligent, healthy-seeming people, who came to me after a stroke and said the exact same thing. Doctor, I felt fine the night before. In the next 15 minutes, I'm going to walk you through 6 sleeping habits and positions ranked from surprisingly harmful to genuinely dangerous for your cardiovascular health, specifically your stroke risk. And then I'm going to give you 2 evidence-backed solutions you can implement tonight, not next week. Tonight, slow down. 6 mistakes, 2 fixes, and every single one of them happens while you think you're doing the one thing that's supposed to help your body heal. Before we go any further, I want to know who I'm talking to. Drop a comment right now. Do you sleep on your back, your side, or your stomach? Just one of those 3. You'll understand why that matters in about 4 minutes. Here's what most people don't realize about sleep after 60. When you were 35, your body was extraordinarily forgiving. Your blood vessels were more elastic. Your autonomic nervous system, the part that regulates your heart rate and blood pressure while you sleep, responded faster and more precisely. Your neck muscles were stronger, holding your cervical spine in alignment even when you shifted positions in the night. After 60, that changes, and it doesn't change slowly. It changes in a cluster. Your arterial walls begin to stiffen. Your blood pressure regulation during sleep becomes less precise. The glymphatic system, that's the brain's overnight waste clearance network, only discovered in the last decade, becomes less efficient. And critically, the vertebral arteries that run up through your spine to feed the back of your brain become more vulnerable to compression and flow restriction. What this means is that a sleeping position or habit that was completely harmless at 40 can become a genuine cardiovascular event waiting to happen at 65. Pause. That's not meant to frighten you. It's meant to arm you. Because once you understand the mechanism, the fix is often simple. That's the framework I want you to carry into everything that follows. Tell me your first name and where you're watching from. I read these, and it helps me understand who this information is reaching. This one sounds so benign, it's almost hard to believe it causes a problem. You're on your side, your pillow is a little too thick, and your chin is tucked slightly toward your chest. You've probably slept like this hundreds of times. It feels comfortable. It feels natural. But here's what's happening inside your body. The vertebral arteries, 2 paired arteries that travel up through small openings in your cervical vertebrae, supply blood to the cerebellum, the brainstem, and the occipital cortex. When your neck is flexed forward at even 15 degrees beyond neutral, studies published in the Journal of Vascular Surgery have documented measurable reductions in vertebral artery blood flow velocity. We're talking a reduction of up to 30% in some positions. In a younger person with pliable vessels, the body compensates. In someone over 60 with any degree of arterial stiffening, that compensation is slower and less complete. The missed symptom here is the morning headache at the base of your skull. That dull, pressure-like ache right where your neck meets your head. You've probably blamed it on your pillow or dehydration, but in many cases it's your posterior circulation telling you it was underperfused for hours. I'll show you the exact pillow height fix in a moment. Stay with me. This one surprises people. Back sleeping has a reputation as the good position, and in some ways it is. But flat back sleeping, completely horizontal, no incline, creates a specific problem for cardiovascular patients and older adults that most doctors simply don't mention during a standard appointment. When you lie completely flat, venous return to the heart changes. Blood pressure dynamics shift. And in people with any degree of sleep apnea, which affects an estimated 39% of adults over 65 according to research in the American Journal of Respiratory and Critical Care Medicine, the complete horizontal position worsens upper airway collapse. Each apnea episode causes a microsurge in blood pressure. Over a 7-hour night, these surges are not benign. They stress the arterial walls. They spike inflammatory markers. They create conditions that make a clot-forming event statistically more likely in the early morning hours, which is precisely why strokes cluster between 6 a.m. and noon. The missed symptom is morning grogginess that doesn't lift for an hour. You call it not being a morning person. But waking with a foggy heaviness that takes 60 minutes or more to clear is frequently a sign of fragmented, low-quality sleep driven by nighttime blood pressure instability. How many of you have been told you snore or woken yourself up gasping? Drop a yes in the comments. You are not alone, and what I'm about to tell you next applies directly to you. Left side or right side, does it really matter? I want you to think about it like this. Your heart sits slightly left of center in your chest. When you sleep on your right side, the heart has to work slightly harder to pump against gravity to reach the left ventricle's optimal position. Think of it like a pump that's been tilted slightly off its base. A landmark study published in the Journal of the American College of Cardiology found that right-side sleeping can increase pressure on the inferior vena cava in certain patients, reducing cardiac output efficiency during deep sleep cycles. More critically for stroke risk, sleeping on the right side has been associated with higher rates of atrial fibrillation episodes during sleep in patients who already carry that diagnosis. And atrial fibrillation, for those unfamiliar, is the #1 cardiac cause of embolic stroke. A clot forms in the heart during an irregular rhythm event and travels directly to the brain. The missed symptom here is the occasional awareness of your own heartbeat when you lie down. That subtle, fluttery, "there's something going on in my chest" feeling that comes and goes. Most people attribute it to anxiety or caffeine. It can be, but it can also be a brief arrhythmia episode, and its timing, correlated with your sleep position, matters enormously. This one is almost universal, especially among side sleepers. The arm goes up, tucks under or beside the pillow, and you drift off. It looks comfortable. It is comfortable in the short term. But the thoracic outlet, that narrow passage between your collarbone and first rib, where major blood vessels and nerves travel from your chest into your arm, becomes compressed when the arm is elevated and rotated. Sustained compression over hours can reduce blood flow to the subclavian artery and, in a phenomenon called subclavian steal syndrome, actually reverse blood flow away from the vertebral artery. Reversed flow in the vertebral artery means the posterior brain is briefly stealing blood from the arm circulation. This isn't theoretical. It's documented. Research from the journal Stroke has described nocturnal subclavian steal as an under-recognized contributor to transient ischemic attacks, what most people call mini-strokes, in patients over 60. The missed symptom? That arm numbness I described at the very beginning of this video, the one you woke up with this morning and shook off. Pause. Are you connecting the dots? If this is landing differently than you expected, if you came in thinking this was going to be simple and you're realizing it goes deeper, type the number 4 in the comments. I want to know you're still here. Your pillow is not just about comfort. It is a structural support device for the most vascularly critical segment of your body, your cervical spine. When a pillow is too soft, your head sinks, your neck falls out of neutral alignment, and the cascade I described in mistake number 1 begins. When a pillow is too thick, your neck is pushed into lateral flexion, bent toward your shoulder, compressing the carotid artery on one side for potentially hours at a time. A 2019 study in the Clinical Biomechanics Journal measured intravascular pressure changes in the carotid artery under different pillow height conditions in adults over 60. The findings were striking. A pillow height deviation of just 4 centimeters from optimal neutral position increased ipsilateral carotid compression by a clinically measurable margin. The missed symptom is facial numbness or tingling on just one side that you notice occasionally when you wake. It might last 30 seconds. It might last 3 minutes. It feels odd, and then it passes. Many people never mention it to their doctor. That symptom has a name in neurology. It's called a transient focal neurological episode, and it deserves attention. Slow down. I want you to really hear this one. Most people think of sleep temperature as a comfort issue. It is not. It is a cardiovascular regulation issue. During normal sleep, your core body temperature drops by approximately 1 to 2 degrees Fahrenheit. This temperature drop is not incidental. It is the trigger for the deepest, most restorative stages of sleep, including the slow-wave sleep during which the glymphatic system clears amyloid plaques and metabolic waste from your brain tissue. When your room is too warm, above 68 to 70 degrees Fahrenheit, this temperature drop is blunted or delayed. Your body compensates by dilating peripheral blood vessels to push heat to the skin surface. This peripheral vasodilation causes a drop in central blood pressure. In older adults with already impaired autonomic regulation, this can trigger nocturnal hypotension, blood pressure that drops too low, too fast, which reduces cerebral perfusion pressure. Low cerebral perfusion during sleep is one of the most underappreciated contributors to watershed infarctions, a type of stroke that occurs in the border zones between major arterial territories in the brain. Research published in Nature and Science of Sleep found that adults over 60 sleeping in rooms warmer than 70 degrees showed significantly elevated nighttime cortisol levels, impaired deep sleep architecture, and markers of increased vascular inflammation by morning. The missed symptom? Waking up at 2 or 3 in the morning for no apparent reason. No noise, no dream, no need to use the bathroom. You just wake up. That nocturnal arousal pattern is a known signature of disrupted thermoregulation and autonomic instability during sleep. What temperature do you keep your bedroom? Drop it in the comments. 68 degrees? 74? I genuinely want to know, and I think the range of answers is going to surprise everyone reading along. Now, here's what you actually do about this. The single most protective sleep position for cardiovascular health, backed by research published in the European Heart Journal, is left side lying with the upper body elevated at a 10 to 15 degree incline. This is not sleeping in a recliner. This is achieved with a wedge pillow placed under the top half of your mattress or a purpose-built adjustable bed position. The left side orientation reduces cardiac workload, improves lymphatic drainage, and, critically, keeps the lymphatic system operating at peak efficiency. The slight incline reduces the risk of nocturnal blood pressure surges by improving venous return without the full flatness that exacerbates apnea. Your cervical pillow in this position should maintain your head in neutral, meaning your ear, shoulder, and hip form a straight horizontal line. Memory foam cervical pillows with a contoured lower edge accomplish this. Standard fluffy pillows do not. 60 to 90 minutes before bed, take a warm, not hot, shower or bath lasting 10 to 15 minutes. The water temperature should be approximately 104 degrees Fahrenheit. What this does is deliberately dilate peripheral blood vessels, drawing heat to the skin surface. When you step out of the water, that heat rapidly dissipates, causing a fast and efficient drop in core body temperature, mimicking and accelerating the natural pre-sleep thermal curve your body is trying to achieve on its own. Studies from the University of Texas at Austin found that this protocol reduced the time to deep sleep onset by an average of 36% in adults over 55. Set your room thermostat to 65 to 68 degrees before you begin this protocol. Keep your feet uncovered if you tend to sleep warm. The feet are the body's primary heat dissipation surface. And while you're at it, keep a glass of water on your nightstand and drink it before sleep, not after waking. Mild nocturnal dehydration increases blood viscosity. Thicker blood clots more easily. Avoid alcohol within 3 hours of sleep. It fragments your sleep architecture and disrupts nocturnal blood pressure dipping, the natural overnight drop in pressure that protects your vessels. If you have a smartwatch or fitness tracker, review your overnight heart rate data. A resting nighttime heart rate that regularly spikes above 80 beats per minute during sleep warrants a conversation with your physician. The immediate monitoring action you can take right now. Tonight, before bed, take your blood pressure. Write it down. Take it again tomorrow morning within 5 minutes of waking before standing up. The difference between those two numbers is called your morning blood pressure surge. A surge of more than 35 mmHg is a recognized stroke risk marker. Know your numbers. I'm not going to tell you to change everything tonight. That's not how lasting change works, and you know it. Pick one thing from today, just one. It might be adjusting your pillow height. It might be dropping your thermostat to 67 degrees tonight. It might be taking that pre-sleep shower. It might be checking your morning blood pressure surge for the first time. Just one. Tell me in the comments which one you're starting with tonight. I read every single one of these, and hearing what you choose tells me what to cover next. If this video gave you something your last doctor's appointment didn't, please give it a like. It takes 1 second, and it tells me this kind of depth is what you're here for. And if you have a spouse, a sibling over 60, a parent who keeps waking up with that numb arm or that base of skull headache, please share this with them directly. Don't just send them to the channel, send them this video. It might be the most important 12 minutes they spend this week. Next week, I'm covering 7 early warning signs in your face, hands, and eyes that neurologists say are far more predictive of stroke risk than blood pressure alone. Signs that appear in the weeks before a cardiovascular event and are almost universally dismissed as aging, fatigue, or stress, but that your body is sending as a very specific distress signal. You will want to catch that one. I'm Dr. Alex Carter. Stay well, and I'll see you next week.